Due to the peculiarities of the immune response, a vaccination that would prevent tuberculosis infection is impossible. But there is the BCG vaccine. This is the Calmette-Guerin bacillus, a virulent mycobacterium that cannot cause disease. It protects the child from generalized forms of tuberculosis, that is, from tuberculous meningitis and miliary tuberculosis, which are especially dangerous for children in their first year of life because they often result in death. This vaccination is given on the 3rd to 5th day of life in the maternity hospital to children who have reached a body weight of 2 kilograms. That is, if a baby is born with a body weight of 2 kilograms or more, we can give them the BCG vaccine. This is a live vaccine. It contains live attenuated mycobacteria, which are not capable of causing the disease, but they produce a very specific response. At the site of the BCG injection, after some time, a swelling forms, then a small abscess filled with a special characteristic pus that looks like cottage cheese. After a while, it opens up, forms a scab, and then a small scar. Previously, the BCG vaccine was administered to children 3 times, in the maternity hospital at 7 years old and at 14 years old. But recently, large-scale studies have been conducted, and the WHO has abandoned BCG vaccination as ineffective. In other words, there is no increase in effectiveness with repeated administration of the BCG vaccine. A person can still become infected with tuberculosis and may even get sick from it, but generalized forms, that is, forms with increased mortality, will not occur in someone who has been vaccinated with BCG even once. Therefore, for children, the only natural and sole method of prevention is BCG vaccination in the maternity hospital. There is no need to be afraid of it. It is a very important and necessary thing. For adults, infection control currently involves ventilation and cough etiquette. That is, since we rarely find ourselves, unless it is a family or professional contactive, we are in an open space with a patient who is releasing bacilli. As a rule, we are not at risk. In other words, we do not spend enough time together, and the mycobacterium dies under direct sunlight. That's why the risk of infection outdoors is minimal. But indoors, where there is a bacilli carrier, it's important to ventilate, use ultraviolet germicidal irradiation, usually with shielded UV lamps, and practice cough etiquette. A person who is coughing should remember that they must have personal protective equipment. What a cough. We should cough into our elbow, not into our hand, not into the surrounding environment, but into the bend of the elbow. This is the most correct way, as it prevents transmission to others. That's it. It is important to remember that if a person knows they have tuberculosis, then for a certain period while, they are just starting treatment and may pose a danger to others, they need to avoid crowds. That means limiting travel on public transport, avoiding visits to exhibitions, theaters, cinemas. In other words, any places where large numbers of people gather. And that's basically it. With a modern approach to infection control, there is no longer any need to disinfect surfaces because, as I mentioned, due to the phenomenon of adhesion, a mycobacterium that lands on a surface even as part of this microaerosol, these tiny droplets can no longer infect anyone. That's why dishes, personal belongings, and so on do not require any special treatment. All that's needed is proper cough etiquette, ventilation, and in specialized facilities, ultraviolet germicidal irradiation. Also, in tuberculosis facilities, both inpatient and outpatient clinics, where patients with tuberculosis are treated, patient flows are separated. That is, patients with drug-sensitive forms of tuberculosis are kept separate from those with drug-resistant forms to prevent cross-infection. Similarly, diagnostic patients, those who have not yet been diagnosed and are only suspected of having tuberculosis, shave a separate entrance in a separate area, so they do not come into contact with patients already under the care of the tuberculosis service. That's it. And in everyday life, apart from basic cough etiquette, no special protection is required.